Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'll be giving y'all my updated thoughts about the new bivalent COVID boosters now that we have a little bit more data about their effectiveness. But first, some of you may have noticed that I took a bit of a break. The reason was that my mom passed away a year ago in November from complications from bone marrow cancer, so I just needed a bit more margin in my life for these past 2 months. But now I'm back and ready to look at some interesting data with you all, so let's get going. In a previous video posted several months ago, I mentioned my recommendation that bivalent boosters should be taken by anyone over the age of 65, but was a bit more unsure about other age groups. I wanted to get some more data. Well, now we have a little bit more. There was a study that was published at the end of November that was conducted by the CDC. I'll put a link in the description if you would like to read it yourself. In this study, researchers attempted to answer the question of how well the bivalent boosters protect patients against symptomatic COVID infection. They did this by getting COVID tests on over 360,000 patients without immunocompromising conditions that had COVID symptoms. Of those who had a COVID test performed, over 121,000, or 34%, tested positive for COVID-19. Researchers then split the groups that tested positive for COVID by age into groups that included 18 to 49-year-olds, 50 to 64-year-olds, and those over age 65. They then looked to see if these patients with a positive COVID test had gotten a bivalent booster, and if so, when they had gotten it. They also asked how many prior monovalent or original vaccines or boosters each patient had gotten. 24% of the patients had never gotten any vaccination at all, so they were removed from this part of the study. Of the remaining 76% that had received various numbers of vaccinations, 5% had already received a bivalent booster. So they then compared that 5% of patients to the remaining patients that had been vaccinated with a monovalent or original form of the COVID-19 vaccine. Here's what they found. For patients 65 and older, the relative vaccine effectiveness of the bivalent booster was 28% if their last monovalent booster was 2 to 3 months earlier, versus 43% if their monovalent booster was more than 8 months ago. For people aged 50 to 64, the relative vaccine effectiveness of the bivalent booster was 31% if their last monovalent booster was 2 to 3 months previously, and 48% if their last monovalent vaccine was more than 8 months ago. And finally, for those aged 18 to 49, the relative effectiveness was 30% if they received a monovalent booster 2 to 3 months ago, versus 56% if their last monovalent booster was more than 8 months ago. So what does this mean? What does relative vaccine effectiveness really mean? This is a difficult term to define, and I had to do quite a bit of searching to really understand what this term means. But vaccine effectiveness can be interpreted to mean the proportionate reduction in COVID among the group that received the bivalent vaccine. So, for the percentages I mentioned, for example, 28% means that there was a 28% reduction in symptomatic COVID among the group that received the bivalent vaccine. Or put another way, there was a 28% reduction from the number of symptomatic COVID cases you would expect if they had not been vaccinated. We can't really use this data to comment on whether the bivalent vaccine performs better than the monovalent vaccine since they were not compared head-to-head. And remember, this study used patients that had a symptomatic COVID infection. This doesn't tell us anything about asymptomatic COVID or the ability to spread it to other people, although we can assume that this will also be lessened. Nor does the study say anything about the most important question about preventing serious illness, hospitalizations, and deaths from COVID infection. And this study was also performed during a period of time when a specific COVID variant was circulating. And of course, these variants are always changing, so we can't be sure how well the bivalent vaccine would work against the newer variants. And like I mentioned previously, the biggest question that still has not been answered yet is how long are we protected with natural immunity or vaccination against severe disease like hospitalization and death from COVID-19? Well, so what do I plan to do, and what are my recommendations to my patients? As I've mentioned before, I just turned 50 years old, and I've received a total of 3 Pfizer COVID vaccines. My last monovalent booster was December 9th, 2021, so a year ago. And so for my age group and the timing of my last booster, the bivalent vaccine effectiveness based on the data from this study is 48%. For me, I don't have the time in my schedule to get sick. Even if I don't have to go to the hospital, I don't want to take a week off from work with an illness that's potentially going to cause a high fever and also have the potential to cause long COVID. I personally have not had any known reactions to prior COVID vaccines, so for me, I will plan to get a bivalent vaccine. But I'm not getting this vaccine to prevent severe illness, hospitalization, and death. I'm confident that I have immunity already. I'm really only getting it out of convenience. And I think our conversation about the COVID vaccine should shift and become one that is more like the conversation we have about the influenza vaccine we get every year. I take the influenza vaccine every year to prevent influenza, and when I can't prevent it, I hope that having a vaccine will cause the case to be milder with less complications. And the influenza vaccine effectiveness is about 50% this year against the current strains circulating. So if I'm willing to get an annual influenza vaccine with 50% vaccine effectiveness, I'm willing to get a COVID booster after 12 months with a 48% vaccine effectiveness. But my husband has decided not to get a COVID bivalent booster. He felt really lousy after his last COVID booster. He missed a day of work afterwards, so for him, it's not worth getting the COVID booster, and I think that's also a rational and valid decision. And remember, if you've had a natural COVID infection, that's equal to getting a COVID booster. And you can start the clock over again for when to consider getting another booster. And at the end of the day, for everyone else out there, this is a very personal and individual decision. The decision about getting a booster will depend on the risk that you want to take for getting sick and your comorbidities like obesity and heart disease. If you think the risks of the potential long-term side effects from the vaccine are greater for you than the risk of getting sick, you can wait to get boosted until the question of how long natural immunity or immunity from vaccination will last to prevent severe illness, hospitalization, and death from COVID. I'm hoping that this type of protection will last a really long time, but we just don't have the data on that. And maybe as the SARS-CoV-2 strain continues to mutate, it will continue to cause milder and milder illness, and this will never be an issue. We'll just have to wait and see. I'd love to read your comments below about your personal decision about the bivalent COVID vaccine. Thanks for joining me.